Hey everyone, this is Dr. Matthew Hernandez, and you're listening to the Ethos Athletes Podcast. Today we're continuing our anti-aging series with Janet McConnell, who's been our guest for this particular series. And we're discussing in particular the impact that weight training has on the brain. So Janet, welcome back to the show.
Thank you, Dr. Matt.
So we've talked about the benefits of weight training on your health in a few different ways. Janet, can you go ahead and just recap what some of those benefits are that we've talked about in the previous episodes?
Sure. Well, there's many benefits, and some of the ones we addressed were having to do with how much it helps a person retain their balance, to regain stability if they've lost some over time, and that obviously reduces the fear of falling. Also, bone mass stays on the body better. So there's a better retention of bone mass, better results when people get their bone mass tested. Joint pain sometimes is reduced because the range of motion that we practice in resistance training helps to strengthen all of the tendons and the ligaments around the joint to make it have better integrity. And there's also probably the most popular area in my practice is the metabolism boost, because everyone wants weight loss to be just a little bit easier. And when you have more muscle on your body with proper nutrition, the extra fat comes off much more easily. So there's a metabolism boost as well.
Yeah, for sure. And so, we talked about metabolism. We talked about how weight training affects mitochondria, which is ultimately one of the biggest things when it comes to aging. When the mitochondrial health goes down, then aging increases. And then I think one of the most important things that we discussed is as individuals age, where they start to worry about that, they start to have that fear of falling and not being able to do stuff, and weight training really helps prevent all that from coming back. Now, obviously, there's going to be we've talked about the different benefits, but the one that we haven't talked about yet is the benefits on the brain. And one of the things that that a lot of people don't realize, or maybe they do realize, but it's not always something they think about when they think about brain health, is that the nervous system is a two-way street. So a lot of people remember that, or that know that the brain controls their muscles. It controls every aspect of their body, but there's also another street going from those muscles to the brain, right? And the brain is the organ that utilizes the most energy in our body, and it basically responds and reacts to what our body is doing, or the different things that we do to our body as well. And so addressing or what you do with your muscles will affect your brain health. And so we're going to talk about some of that today. And Janet, I know this is something that you have a particular interest in, and that you've had personal experience with when it comes to actual diseases that affect the nervous system. In this research that you've done, out of your own personal love just to research, what have you found as far as exercise, the benefits of weight training itself and on the brain?
Well, it's interesting because in training clients, we talk a lot about the mind-body connection. And when I talk to my clients about that, I usually mean having a focus on what muscle is being worked and the feeling, so that they become familiar with what's actually happening in their body, so that they're understanding. So it's a mind-body connection of what's happening. But it makes sense then that there's really more to it, because not only does the brain direct what the body's doing, but what the body's doing feeds back to the brain and gives it what it needs.
Yeah, you worded that way better than I did. Good job. Good job.
Well, it's sort of a way where the chemicals that are released when we use the large muscles, especially leg muscles, because those are the big drivers, they release a large amount of chemicals that highly stimulate the brain into regeneration. And so it helps with so many different things in cognition. It helps with improving the blood flow to your brain. That's obviously all over the body, but the brain gets the same benefit. Increased production of nerve protecting compounds. There's a lot of plaques that can build up in the brain, and also some damaging proteins that can build up through stress, through environmental factors, that can increase a likelihood of some of the degenerative diseases that are associated with the brain. But the exercise can reduce that over time and make it better so that there's more regeneration happening and less degeneration happening. And that's really the basis of what makes us stay younger or get older.
Yeah, absolutely. And so research has shown, or I guess before I even go into that, as we age and we're looking at the nervous system, the things that we worry about with aging with regards to the brain is decreased neurogenesis. And neurogenesis is when your body is able to produce and develop new nervous tissue, so new neurons, all these things, this nervous tissue. If as we age, we lose that ability to be able to produce those. We also have more neurodegeneration, so that the nervous tissue that does exist actually starts to degrade over time. And then we also have cognitive alterations, where we start to lose our memory a little bit, or there's risk of losing memory. There's risk of being able to not being able to focus anymore. Various things like that. And as we there's studies that show that weight training will actually prevent all that. So it'll increase neurogenesis, it'll decrease neurodegeneration, and it'll decrease the cognitive alterations. And so we can actually produce new nervous tissue, regenerate the tissue that is being degenerated, and then also prevent all the memory and focus problems that come along with aging. Now, you had mentioned a study about some twins that you read, correct? Mm-hmm. You want to talk about that a little bit more?
Yeah, twins are interesting because a lot of times people will say, well, the reason that person lived longer is because they just have it in their DNA. Their family genes gave that sort of extra little boost to them. But when you study twins, and you come right down to it, twins have identical DNA. So they make a really good sort of way to study genetic differences. Anybody who's observed twins over time, if you ever know a set of twins, at the beginning of life, they look very alike. They love trading places with each other, and they can get away with it. But when they get to be 50, 60, 70, 80, they don't look exactly alike anymore. And I can speak from experience because my father and my uncle were identical twins, and you could tell them apart much later in life. So in this study, I really was drawn to it because they took two identical twins, and one of the twins exercised, was more of an athlete and really loved to work hard in the gym and on the track field. So she became stronger, and her cognitive function over time was far higher than her weaker twin who did not practice in athletics. So the stronger of the pair experienced fewer age-related brain changes.
Okay. And so obviously the exercise did help with all that. Mm-hmm. Now, one of the other things that research has shown is we talked about the neurogenesis and preventing neurodegeneration, or preventing the breakdown of that nervous tissue. When we talk about diseases such as like Alzheimer's, Parkinson's, multiple sclerosis, various things like that, those are all diseases that can negatively impact the nervous system. And the studies have shown that resistance training and weight training helps prevent that from getting worse, essentially. Mm-hmm. Now, you have some personal experience with that, correct?
Right. I have a client that I have trained for well over a year, and he came to me, already had Parkinson's, and was very concerned about the prognosis of what is my life going to be like in 10 years. his doctor recommended that he get a good exercise program that would help him both physically and emotionally, mentally, with anxiety of what was to come. But in the process of working with him, of course, he got much stronger. He lost a good 25 or so pounds because we worked on his nutrition, and he just became younger.
Yeah.
And so a year later, when he got together with his friends for their reunion, so to speak, party that they have once a year, everybody commented, "You look so much younger. What are you doing?"
Yeah.
And he just told them about his resistance training. But then the other part of it is he goes to several doctors, a neurologist, a cardiologist, and a regular doctor. And his neurologist, of course, is responsible for managing any of the symptoms he may be experiencing with tremors and such. And he commented how it's interesting, he doesn't seem to be getting worse. And the doctor was kind of scratching his head. Like, this is not normal.
Yeah.
I should be having to up your medication. Also, his cardiologist looked at all of the data, excuse me, and said, "I can't tell from looking at your EKG that you have Parkinson's."
Okay.
I can't tell.
Yeah.
And his regular doctor was so impressed with his weight loss and his balance and his ability to lift things and to be able to get up out of a low chair and so on. Just keep doing what you're doing. So it looks to me like in real life, Parkinson's, it's a serious disease, but it can be mitigated largely
Absolutely.
by working the large muscles, and his quality of life is so much better and will be for so much longer.
Yeah, that's great. Now, you also have a similar experience with a multiple sclerosis patient, correct?
Right. I've been training a woman with multiple sclerosis for almost 5 years now.
Okay.
And she has very few really obvious symptoms and has not gotten worse. She just ran a 5K recently and had to walk a part of it, but realized that she could still finish.
Yeah.
And she also does yoga,
Okay.
because that is another way of helping with her muscle strength and balance. But she finds that she's able to continue doing most of the things that she, and this is over a much longer period of time than my Parkinson's client. So almost 5 years now running.
That's
and
awesome.
She's still able to do everything that she did before with just some slight differences.
Yeah, but it hasn't progressed the way it typically does with most patients that don't do any weight training. That's really cool.
Yeah.
So then how much, or if someone is wanting to benefit from weight training on their brain health, how much exercise do they have to do, in order to see that?
There's all different reports on that. Some reports that are less comprehensive, just they encourage walking, that walking daily can be a help and will help, but it's not nearly as powerful as resistance training with the legs and strength training. So the doctors that were in the research articles that I found all recommended 2 to 3 days a week, about 45 minutes or so each time.
Okay.
And that would be enough to, I think that they have a hard time defining it because every workout's different.
Oh yeah, absolutely.
And they're kind of like throwing it out there.
Yeah.
But I suppose, 30 to 45 minutes of really focused squatting, lunging, and resistance training machines that work the quadriceps and the hamstrings and the glutes really deeply would be enough. And that's pretty much what I do with my clients anyway, no matter whether they have the disease or not.
Yeah.
Because it helps everybody.
For sure.
But it makes a big difference for my folks that have the extra challenge of the brain disease.
Okay. And the research does show, in fact, like it's specifically focused on lower legs.
Mm-hmm. Yes.
Okay.
Yeah, it said it's even better because the large muscles have a stronger impact on the release of the neurotransmitter chemicals that make the brain wake up and pay attention.
Okay.
All the muscles have some.
Right.
But it's like, double whammy with
Okay.
the leg muscles.
Yeah, so don't skip leg day.
Right.
That's,
Yeah.
That's even more so.
Yeah.
Do it.
Friends don't let friends skip brain day.
No, I love that. Cool. So we discussed the benefits of weight training on the brain. Some of those ways were it helps produce new nervous tissue, helps regenerate nervous tissue, helps prevent cognitive decline, also increases blood flow to your brain, reduces the damaging plaques in your brain that come from Alzheimer's, various things like that. Increases mood, and that's most people. I mean, a lot of people don't like waking up and going, but every time they do it, they always say they feel better.
They feel better on the way out. Yes, everybody does.
Yeah, absolutely. And then it also helps with the production of those nerve protecting compounds as well. So those are just some of the things that it does for brain health, that weight training does for brain health. Is there anything else you'd like to leave our listeners with?
I think the main thing is that it's important to have accountability in your life, so that if you're listening to this and you feel like, wow, this all makes sense and it's a really good idea, but you don't have something in place where you are actually practicing working your leg muscles 2 to 3 times a week in a powerful way besides just walking, then look around you and find a way to get an accountability partner, either a friend or a coach or something, to keep you in it. Because no matter what decade you're living in, life is a special occasion. You have to train for it.
Yeah.
And that's the only way to really maximize your chance of living a long time with high quality and enjoyment.
Yeah, I love it. That's great. Well, Janet, thank you for being part of this series. We really had a pleasure having you on.
Thank you. I enjoyed it too.
Yeah. Everyone, thanks for listening, and we'll catch you on the next episode.